that's what I'm most hopeful for, is finding ways to avoid these side effects and symptoms from even occurring to begin with.
Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I am interviewing physical therapist Kelly Sturm, who is also known as the Cancer Rehab PT. She is a board-certified oncology specialist. She's also certified in lymphedema therapist. And today we are discussing the role physical therapy takes in your cancer rehabilitation process. So without further ado, here is Kelly. Well, welcome to the show, Kelly. Thank you so much for joining me today.
Yeah, thanks for having me. I'm excited to be back.
Yes, for our listeners, Kelly's been on probably about a year ago or so. We talked about lymphedema primarily on that interview where you went in detail on that. But today we are going to be talking about cancer rehab from a physical therapist perspective. So I think that leads me into my first question is, can you tell us a bit about your background and what led you to specialize in cancer rehab?
Yeah, absolutely. So I graduated from physical therapy school at the Mayo Clinic. Let's see, it's been 12 years now, and I had some exposure within some of my internships on their breast cancer rehab floor at the time, which was their only one. And I just really enjoyed it. It was an area for physical therapists that wasn't well known and still really isn't. But just seeing how much opportunity there is for us to support those who are going through cancer, who have had gone through cancer. Is just, it can make a massive difference in the long run. And, 1 out of 3 individuals will have cancer. So we know that it can affect a lot of people. And what we also know, treatment's improving. And so survivorship's improving, but people are left with these side effects and symptoms. So what can we do about it? Well, cancer rehab is one of those things. So something that I've really enjoyed doing.
For our listeners who aren't aware, Bob went to the same school just way, way long ago. So where can people find you at online?
Yeah, so I have a website. It's cancerrehabpt.com. And I'm also on YouTube, same thing, Cancer Rehab PT. Have a lot of videos for cancer rehab, but also for lymphedema or lymphatic health. And then same thing on Instagram. So Cancer Rehab PT.
Do you work with people in person or online or both? Or
right now, currently, I do see individuals locally to me. I'm here in the Twin Cities in Minnesota. So locally, not quite yet online, but I do have different, again, video resources, programs that are online that are available for people.
Sure. So what exactly is cancer rehab and how does it differ from other areas of physical therapy?
Cancer rehab, surprisingly, but people think it's so different. It's really not completely different than what we see in other areas. We are looking for what are you physically having issues with? So with cancer and cancer treatment, we see a lot of weakness, fatigue, pain, various things like that we would see for other conditions or other issues. And we just treat them specifically for their cancer versus another issue. But at the end of the day, we treat them very similar. So just know that if you had therapy for another type of weakness, we may also see that when it comes to cancer rehab too.
Yeah, my old setting was primarily skilled nursing facilities, or for the older person nursing homes. That's what we used to call them. So we saw inpatient, outpatient, but the only time I really had cancer patients was like they'd do rehab stays there if they got really weak, anywhere from a few weeks to a couple months. But yeah, typically it's kind of the same thing unless it was, I think I saw one young gal who had, I can't remember if she had, it was in her, I remember her pain was in her armpit. I can't remember if it was breast cancer, if it was like the lymph nodes. I can't remember.
Melanoma or something. Yep.
Yeah, but I do recall that. But yeah, it's a lot of the similar stuff. So what do you primarily treat?
I do treat all cancers. I would say specifically adults. I am not in pediatrics at this moment, but the majority of the individuals I treat are breast cancer, head and neck cancer, melanoma, that's prostate cancer. Those are the majority I see. And it's really just because those are more common cancers. But I also see lung cancer and pancreatic cancer and others as well. So.
Sure. So at what point during a cancer journey do patients typically begin working with physical therapy?
Yeah, right now we see a lot of people after cancer or during, because that's simply when their side effects or their symptoms start to show up and they start to notice it or have conversations with their doctor. Ideally, we're seeing individuals earlier, even before these symptoms and side effects begin, because we expect a lot of these side effects to come out when it comes to the treatment. Chemotherapy, radiation, a surgery, they all are going to cause some sort of side effect or symptom. So if we can address them early and stay on top of it, where our goal is to minimize it. So ideally, we see someone right away, but definitely if someone has any side effects or symptoms that come up during or after, we absolutely want to see them. And there's never a time that it's too late. I've had individuals 30 to 40 years out of their cancer treatment, and we still have a lot of things that we can improve. So just know that anywhere on the spectrum when it comes to cancer, physical therapy can be appropriate.
Yeah, I was reading your about section and then I noticed it was a story about someone that had cancer 29 years ago or something.
Yeah. Yep. That's really one of the main reasons I started my resources and my website is really understanding that there's a lot of gaps on understanding what there is to be done when it comes to addressing these side effects. And for some people, they just, think that that is their new normal, that they have to live with this new pain or tightness, or after they have radiation in the breast, the shoulder range of motion is lower. They assume that that's normal. And it really, I don't love that. I want to make sure people know that we don't have to make that the new normal. There are things that we can do to improve all of those things. And maybe not 100%, but can we reduce pain 80, 90%? That would be a great goal. And I think it's something that's achievable for a lot of people.
So, what are some other impairments or side effects you commonly see? I know we talked about fatigue, weakness. You just mentioned some shoulder discomfort from breast cancer. Are there other things you see a lot of?
Yeah, we see it. It really depends on the treatment. So, chemotherapy, we see a lot of fatigue, a lot of weakness, peripheral neuropathy, or that tingling and numbness in the fingers and toes. When it comes to radiation, we see a lot of tightness, pain, loss of range of motion, from what we call fibrosis, which is kind of the scarring that happens or can happen, not for everyone. And then we see for surgery, just your standard post-surgery swelling, lymphedema, tightness as well. And then some one-off areas too. For head and neck cancer, if someone has radiation, they might have jaw pain. Same thing when they have gynecological cancers, we might see pelvic floor issues. So it's tailored more to the area where the cancer is addressed or the treatment is as well.
So, you have to be an expertise in every area of the body, I suppose, huh?
Yeah, you try to be. Otherwise, we definitely have people who specialize, and if we don't know how or it's not our specialty, we will find someone who is and make sure that someone gets the care that they need.
Sure. Yeah, I always send them to the pelvic health people if they have
Yeah,
those issues. I'm
they're
like,
great.
this is not my forte. So, I can't speak today. What role does exercise play in cancer rehab, and how do you safely introduce movement for someone who is having a lot of pain or fatigue?
Yeah, exercise is one of the biggest things. And there is research coming out that says cancer related fatigue is the number one side effect that comes along with cancer. And that happens for people, whether they've had chemo or radiation or surgery. It comes for 99% of people. And they've done studies and looked at medication and how that helps with fatigue or just rest or whatever. And it's showing that exercise actually has the biggest impact on helping fatigue when it comes to cancer. So we know how important it is just for general health, but it can be really beneficial for those who have specific side effects from cancer treatment. So we just want to get someone moving. Just start something small. It doesn't have to be anything crazy, but movement is helpful. And I know it's the last thing people want to do when they're having treatment and they're tired and fatigued, but it is probably one of the best things they can be doing. So we try to meet people exactly where they're at, start somewhere light, but any sort of movement, finding something that someone enjoys doing can be really beneficial.
It's a sad story, but I remember I can't think of his name off the top of my head. He was a anchor on Sports Center for a long time, and he had cancer. And every time after his treatment, he would make himself go work out for like an hour and a half, no matter what. He did like boxing and all this different stuff. But I just remember him like explaining his story that felt like he could have control and at least do something. So that's what he always did after every treatment session, even no matter how exhausted he felt. Unfortunately, he's passed away now, so sad story in
Yeah.
the long term. But I remember he lived for a long time dealing with it. So I think the exercise and just being as active as he was, prolonged his life at least.
It definitely does, and I like what you said, and it's something that we use a lot too, is there's so many things that you don't control when it comes to cancer and cancer treatment, and how you show up with activity or physical activity and some of those daily things is something that we can control, or do our best to control, and can play a role. So that gives people empowerment to do something for themselves that when they feel like there's not a lot else they can be doing.
His name, I had to check. His name, Stuart Scott was his
Yeah.
name. Now I remember. Oh yeah, he passed away in 2014. Oh, that was a while ago now. Okay, anyway, I get distracted. Next question. Are there any, well, this is going to depend upon the type of cancer. What are some good options of exercise to do? You could talk about stretching, strengthening, or even manual therapies. What do you commonly rely on in your treatments?
Yeah, we want a little bit of all of it, really. So there's a lot of proof that cardiovascular exercise combined with strength training is the best. And of course, we want flexibility in there as well with stretches when someone has tightness. But we try to aim for 3 to 5 days a week of even 20 to 30 minutes of cardio. So for some people, that might be on a recumbent bike, or it might be just going for a walk. It's going to look a little different for everyone and what is challenging for them. Strength training, our goal is really just twice a week. Full body, try to get some upper body, some lower body, whatever that looks like, whether it's body weight or we use resistance. But we want to try to do strength training twice a week. And that combined has shown to be really the best thing out there when it comes to exercise. But I always say find something you enjoy doing. So if someone loves pickleball or swimming or whatever that might be, we can absolutely embed that in and make sure that that counts towards whatever your goals are with these exercises.
Yeah, I think a lot of it depends upon the age, because my previous setting was, primarily Medicare age and older. So we were just walking pretty much or doing stairs for functional activities with them. But obviously, like the younger gal I saw in her like late teens, early 20s, hers was more just pain management, range of motion stuff, obviously, because she was pretty high functioning yet. So cancer-related fatigue is a big issue. So how do you address this? I'm guessing just tailoring the exercises to the individual.
Yeah, exercise in some capacity. Again, meeting someone where they're at, because moderate amount of exercise for one person is going to be very different than it might be for another person. So, whatever might be slightly challenging for them, we're going to try it there. We also want to consider things like balance. If someone has neuropathy from their chemos and they don't feel steady, we'll do something seated, like a seated bike, versus going for a walk or getting on a treadmill. So we'll tailor it and customize it for each person. Again, we want to find something that someone enjoys doing as well, because that's easier to stick with and be consistent with. So, but yeah, some sort of movement, some sort of exercise is by far the best thing someone can do for fatigue.
So I know you know a lot about this because we did a whole podcast on it, but lymphedema is a concern for many people, especially after their treatment. So how can you manage that through PT?
Absolutely. Lymphedema, we are getting better. We're not quite there yet, but getting better about getting that, addressing it earlier. And the sooner the better, because we know that lymphedema is a progressive thing. And so if we can get it sooner, our goal is to keep it as mild as possible or as minimal as possible. And so that might look a little different for each person, but ideally we are screening someone even before their surgery, which doesn't happen very often, or getting to them right after, screening for lymphedema, teaching them what to look for. And then if we see any signs of swelling that might be lymphedema, then we can address it with various things like compression, bandaging, compression garments, or whatever else someone might need.
I'm assuming it depends on the type of cancer and if lymphedema affects it more frequently or not, correct?
Lymphedema can show up in any part of the body, but really
Yeah.
what it comes down to are lymph nodes removed or radiated or treated, because it's the removal of lymph nodes that affects the lymphatic system the most. So, for some some types of cancer or some stages of cancer, they may only have one lymph node taken just to biopsy versus another stage, they'll have 20 to 40 lymph nodes taken. And so, yes, we look at risk levels as well and how closely we watch someone or how we treat someone. But it doesn't necessarily matter the type of cancer per se. Like some cancers don't get don't get surgery. They just have chemo, so they are less likely to have a lymphedema versus someone like a breast cancer who has lymph nodes taken often.
Sure. So, are there any other long-term side effects that you commonly treat after someone's dealing with cancer?
Yeah, the list is so long. I will say it's very long. If someone has it, we will look at it physically. So we see a lot of fatigue. We've already talked about that. A lot of lymphedema. We see a lot of tightness and scar tissue, both from surgeries, but also radiation causes what we call fibrosis. So we're treating that, which limits range of motion, affects strength. So weakness is another big one that we see a lot. But yes, scarring from surgery we'll treat. So we're doing a lot of manual therapy there. Again, the list, neuropathy, so balance affected with that as well. The list is very long. But again, if it's a side effect or a symptom that comes with cancer treatment, there's a very good chance that we are addressing it.
Yeah, I've had a few patients recently. I'm in like an outpatient setting now, but I've had a few. It's connected to a hospital, so it's a lot of orthopedic surgeries. But we have a ton of shoulders, and there's been a few I've noticed that once had breast cancer, and then they've had that side like shoulder issues now. And now they have surgery even. So I could see how you can have a lot of long-term effects from it.
Yeah, absolutely. Like that's something to be aware of. And I work a lot with orthopedic therapists, just training them on what to look for. And, when you go into a surgery and, 1 out of 8 women will have breast cancer, so have some sort of treatment in the past, there's likelihood that they're also having an orthopedic surgery too. So it's really good for therapists to also be aware of someone's cancer history and what their treatment is. And again, refer out if they're not comfortable treating those type of things.
Sure. So obviously, cancer rehab is very physically demanding, but there's also a large emotional and psychological component to it. So what are some resources or things you do to help with your patients?
Absolutely. I think the biggest thing is when you work in this space, it's really important to just to listen, to slow down and listen. There's a lot for this individual or these individuals to take in. There's a lot coming at them. It's a lot of information and it moves very quickly. When someone's diagnosed, everything happens very quickly, and it can be a lot. So it's really great for them to have a caregiver or a friend or a family member join them for sessions just to help take in some of the information. But you'll have to just try to repeat if you need to help with strategies. And the end of the day, it's again meeting someone where they're at. So finding something that they enjoy, empowering them to take care of themselves in a way that helps meet their needs, but also gives them benefit that we know is beneficial. And that's going to look a little different for everyone as they digest a lot of this information, they digest the treatment. And for some, it's how they're coping too. So we also have plenty of resources that we work with closely with our counselors and our psychologists and anyone in that realm as well, because we know, again, you can't throw everything at them. It's a lot to take in. So we just go small step by small step, but also, again, slow down and listen and just be a listening ear too, because there are days that are tougher than others.
Yeah, I feel like as therapists, we see them quite frequently a few days a week, depending upon your settings, sometimes even 5 days a week if you're in a nursing home. So I feel like they get comfortable with us and could talk to us where they see their physician, once a month. So I would
Yeah,
say just listen. I mean, this pertains to any issue. I've had people go on soapboxes and I'm seeing them with foot pain. So it's not just cancer rehab.
right. Yeah. And that's why it's important too for therapists to be aware of just communicating with other disciplines and the doctors. And it's all about being a team. The patient is the center of that team. They drive a lot. The doctors drive a lot. But we all work together because we're just trying to do our best to make sure that all the needs are met for that individual.
I think that goes into my next question pretty well. So, how do you work with a multidisciplinary team, and how important is it to have a team-based approach to things?
Yeah, it's extremely important. It's important for any group, but it's very important when it comes to cancer and oncology because treatment drives side effects and symptoms, and they can change and change very quickly. And everyone needs to be on board for safety reasons. Everyone needs to be on board for just awareness. And again, it's a lot for the patient to take on. And so we need to make sure that we're fully communicating together so they feel comfortable and confident with all the decisions being made and helping them make their decisions as well. So our teams are very large, whether it's the medical oncologist, the radiation oncologist, the surgeon, the plastic surgeon. The list goes on when it comes to that group, but then also you think about the dietitians and the psychologists and the therapists. We have the OTs and the PTs and the speech therapists as well. So, and the list keeps going. So very, very large teams. And it's important for us to communicate together, but ultimately making sure that the patient understands that we're working together to help, bring some comfort to them that we're all on the same page.
I'm presuming a lot of them have protocols they sent. I don't work with a lot of cancer rehab currently, but I obviously have protocols from everything else. Is that kind of the case where you're at?
It is. It's really doctor to doctor, surgeon to surgeon. So each surgeon has their own post-op protocol. So you just know what surgeon you're working with and communicate that clearly. And each radiation has their own protocol. So again, it's why it's important to make sure you know who's on the team and you're communicating with each team because each person has a little bit different protocol that they want to follow.
Is your practice like one you own, or is it connected to a hospital, or what is it exactly?
Yeah, so I used to work for a hospital system locally to me for 10, 11 years. And the last year plus, I have been in a private practice setting in an outpatient setting.
Oh, okay. So you probably get referrals from kind of all over.
Yeah, I get a lot of referrals from all over. But again, I just see people locally in person.
Oh, yeah. I just mean from numerous facilities around you. Sorry. In my head, I knew what I was saying. So, what does the research say about benefits of physical therapy during and after cancer treatment? I know you mentioned the importance of exercise, but is there any other research you want to bring up?
Yeah, there's more and more coming out, and it's showing a lot of benefits when it comes to decreasing things like hospital stay and quicker recoveries. And when it comes to some of those more intensive surgeries, like the ones that come with pancreatic cancers or lung cancers, they can be a lot more complex and have longer recoveries. And we know that doing therapies during, whether it's the exercises or just getting moving, can shorten the stay within the hospital, but also lower readmission, decrease the risk of falling, just because you're getting stronger sooner. So there's a lot of benefits during and then after, of course, as well. All of the side effects I mentioned before, we're addressing those consistently as they come up. And there's a lot of research is showing that therapies and some of the things that we do when it comes to exercise and strength training and range of motion can help decrease those side effects as well.
So are there any new like tools or technology that you're finding has been beneficial?
When it comes to cancer rehab specifically, exercise is just such a golden thing. It's different types of exercise is great, but when it comes to how do we reduce the risk of these side effects and symptoms coming with all the treatments, they are learning more and more. And breast cancer is leading the way because it tends to have, this has the highest number of people, so the research tend to be higher there. But they're finding ways to lower the risk of things like lymphedema and how they do their surgery, lowering the risk of having any nerve issues after by how they're doing their surgeries. They're trying to find ways when they're doing treatment to minimize side effects in the long run, which of course helps everyone. In cancer rehab, we love that. We want people to have less issues long term and not need us as much as well. So that's what I'm most hopeful for, is finding ways to avoid these side effects and symptoms from even occurring to begin with.
Sure. So yeah, I feel like every surgery is getting so advanced now. They barely even need to just do a little incision like that and replace a bunch of stuff in your knee.
Yeah, it's getting better, and cancer gets a little more complex. So we have a little ways to go versus
Yeah.
orthopedic, but there's some promising things coming out, and definitely looking forward to seeing those.
So, what advice would you give to a recently diagnosed cancer patient, not sure what the road ahead looks like, and what are some important things they can try to do ahead of time before they go through with everything?
Yeah, it's tough because so many people when they're diagnosed, things happen very fast. And so the biggest and I get this from my patients who would want to pass this on to them more so than for me saying is they found it most helpful to really rally in people to help them. And now some people don't like to be asking for help, but even having someone come with to the appointments and take notes, having another ear because it's so much information coming so quickly. It's easy to forget things or just not hear it because you're processing other things. So just having people come with you, having people help support you in that way. It's a lot of appointments really quick as well. So getting people to help with just driving, bringing you there, meals, I think is one of the most important pieces because it is so much to take on. And then from there, other things, speaking up, asking, communicating to the doctor, asking questions, getting multiple opinions if they're not comfortable with something. Those are all really helpful. But at the end of the day, again, it's just a lot and it comes at you very quickly. So don't be afraid to just take a moment, surround yourself with the people you need to, and then start to move forward.
So, what do you wish more people understood about the importance of doing physical therapy during their cancer rehab?
Yeah, and I understand. I could speak all day on how helpful cancer rehab really can be for all of these things that come with cancer and cancer treatment. So I guess that's one thing, but at the end of the day, um, I just know that it's a lot to take in, and it's okay if it's overwhelming. Meaning for me, if you could do your exercises every single day, 20, 30 minutes a day, that'd be great. But it's probably not realistic for some people to do that because of everything else going on. There's a lot of other appointments going on. So just know that if you're doing your best, you're doing enough. And even if that means 5 minutes a day of trying to do something with movement, it's very helpful and it's beneficial. So I just want people to feel guilty for not doing enough when they already have so much on their plate.
So, I noticed your site, you have some free resources for people, but then you also have some different type of programs. Do you want to talk about what some of those are and who could benefit from them?
Yeah, I'm happy to. So I, over the last decade, have been doing this, and I've learned very quickly that not everyone has access to someone who specializes in cancer rehab or feels comfortable with that. And I learned that probably the hard way. Assuming someone did, and I was naive to think that was there. So the goal would be that someone finds someone locally that can give them the individualized, customized support that they deserve and that they need. But when someone doesn't have support, doesn't know where to start, doesn't have access to any of this, I put together these programs really of all the main things that I treat when it comes to the breast cancer or lymphedema, and there's more coming. But just to give someone a place to start, or for therapists who want a way to help as well. So gives them some tools that they can bring to their therapist. So they're there for someone who needs that. I'm always genuinely want someone to get individualized care. I think there's nothing better, but hopefully their resources here are going to be helpful for those, especially who don't have access to that.
So, would you like to mention your website and YouTube channel again?
Sure. Yeah. So, and the resources they're talking about can be found on cancerrehabpt.com. And YouTube, same thing. A lot of free videos there for various things, including lymphedema. It's also at Cancer Rehab PT on YouTube and also on Instagram.
Well, thank you so much for joining me today. Do you have any last remarks or things you'd like to mention that I forgot?
Not specifically. I appreciate you letting me come on. Like I said, just bringing awareness to know that if someone has had cancer treatment, or a loved one who has, and even if they are decades out from their treatment and they're still having side effects or symptoms, that this is an area of therapy that can be very beneficial. It does not matter how far out you are. And hopefully you can find someone close to you to just get back and focusing on the things that are most important to you in life.
So any viewers or listeners, I will link all of Kelly's websites down below in the comment section. And I will also link our YouTube or podcast before on lymphedema if you're interested in that. So thank you so much for listening. And thank you, Kelly, for joining me.
Thank you.